The second edition of the Ritshidze Report on the state of health in the Free State shows that the impact of the COVID-19 pandemic has had a negative impact on the province's fight against HIV and TB treatment. To give us more insights on this, we're joined by Sibongile Tshabalala, a TAC Chairperson. Very good morning to you. Thank you so much for your time. The numbers are not looking good when it comes to accessing treatment, especially in the Free State. Talk to us about some of your findings.
Good morning, and thank you for inviting us to speak about this report, which is a very important report. And in this report, we are not really excited because it's worsened from the report that we launched last year, September. So we found out that most of the services on the ground are not happening in the right manner. However, we are also excited because the Department of Health in the Free State has agreed to these to the recommendations that were issued by this report. So what we find out is that waiting times, it's still not that it's still bad, because from 5.56 people from 5 hours, I mean more than 5 hours, people are still waiting for more than 5 hours. And the department has agreed to say they will try to arrange the space, appointment space for people on the ground, so that it will be easy for them to be able to improve on that side. But also we noted that the staff level have worsened by 79%. So it means mostly of 79% are understaffed, facilities are understaffed, which makes it to be harder, or it carries a burden for the staff to give people to services. But also Department of Health has committed onto this to say they will try to communicate with the National Department of Health and the agencies, so that they can be able to get more budget to respond to the issues that need staffing. We have noted also again that in the Free State, the ARVs, it's not, like rollout of ARVs, it's not as improved. 15% of people who were interviewed, they said they're not getting 3 months treatment. But the department, when we engage with them, they agreed to say they will improve on that side, so that people can get their 3 months to 6 months treatment. And also the issue of external picker points, since they have the challenge of staffing. So that is why the external picker points, they agreed that they will make sure that they improve on that side, so that people can be decanted to other facilities or other external facilities, so that it will lessen the burden on staff level. But also we noted the issue of staff attitude, which is only 41% of people who were interviewed who said they found staff being professional and friendly, but 56% they are still saying that they are sent back to queue when they miss their appointments. But also on this one, the Department of Health in the Free State has also agreed with the recommendations to say they will talk to nurses to be friendly, and they will try to sensitize them and make them understand that there are a lot of reasons that people may to miss their appointment. I'm sorry.
So the other factor was also speaking to files going missing. The report also highlighted that as a deterrent for people who may be wanting to access treatment.
Yes, it is problematic in Free State that files are not there accessible, or sometimes people, when they get to facilities, they don't get their files. And the filing system, it's not only the issue of Gauteng, but of Free State, I'm sorry, but it's the issue all over the country, because we are still not yet converted to the tier.net and the other IT technical style of doing things. So the Department of Health is still working on that. But then the Free State, they said they are committing also to that, to say they will try to improve on that side, although there are still difficulties in terms of changing from the paper files to IT system.
So although there have been some great strides in the fight against HIV and TB, we know COVID-19 had a major impact on those efforts those efforts on the fight. Talk to us perhaps about what would happen, what has happened when a person has not been able to access their HIV treatment. I mean, you speak about not getting sufficient access to the long-haul treatment. The 3-month and the 6-month treatment is what you were making mention of. But the impact on one's health and well-being without the access. Talk to us about that.
Remember, when you are taking ARVs, you need to take your ARVs all your life, because the treatment, the ARVs that we are taking are not curing the virus, but they are suppressing the virus. So if the person misses the taking treatment, that means now it gives a chance for the virus to continue to multiply in your body, and also to continue to attack your immune system. At the end of the day, you will lose more people with the issues of AIDS-related deaths. Will experience that more. But also, when people are defaulting on treatment, they are putting other people at risk, because these people, when they have relationships, in most cases they don't even use condoms. So it's easy to transmit another person, of which when a person is on treatment, we know that that person, the viral load will be undetectable, and that person, the risk of infecting another person are very slim. So that is why also we are advocating for U is equals to U, which means untransmittable and is equal to undetectable. So it means when a person is living with HIV and taking the treatment and the viral load is suppressed, the person has lower chances of infecting other people, which is another prevention strategy that the country has to work on, and we are supporting it as people living with HIV.
The report also focused on treatment and viral load literacy, which is also a very important aspect of one living with HIV.
Yes, treatment literacy is very important, especially for people living with HIV. Once you are treatment literate, it's easy to know what to do and not what to do, but also you understand how to survive with the virus in your body, and you will understand why you have to continue taking your treatment, why you have to adhere to your treatment, and you have more chances of living longer than when you are not taking your treatment correctly.
TB also came out, especially during COVID-19, and the concerns around access to treatment and those who may be moving away from treatment. How is that looking when it comes to what the report has uncovered and the recommendations that are now being made?
It has shown that it's still not doing well. The Free State report shows that they are still not doing well in terms of TB and the issues that needs to be supported in terms of TB. And we know that people are moving around, and people, because of the treatment that they are not getting in the facilities, which is bad treatment, most of them, they don't also take their treatment, which means then we'll lose more people on TB, while we are having a recovery plan in South Africa, where we are trying and pushing for government to fund that plan so that we can start using that plan in terms of responding to issues of TB. But the Department of Health of Free State has agreed to this, and also committed to say they will try to have more community healthcare workers to assist on this, which are called ward-based team that will always go and look for people that are not adhering to their treatment. It can be TB, it can be COVID, but also it can be TB, it can be ARVs, but also when we refer to the issues of COVID, we remember that most of the budget that was allocated to respond to HIV and TB and other things that are healthcare related, it was reallocated to address the issues of COVID-19, which it has also put a burden to issues to respond to other issues like HIV and TB.
Very lastly, before we let you go, as some viewers who may be watching and feeling discouraged, of course, looking at the queues and all the challenges that come with accessing treatment, what words of encouragement would you offer as the department is now scrutinizing the challenges and trying to find a way forward?
What we can say to people who are there and are struggling with getting treatment, please, people, they should be patient, but they shouldn't allow themselves to be abused by the system. We are here as people living with HIV, as the organizations to speak on their behalf and to advocate for them. But then also they need to report these cases, even to the facility manager, district health manager, and they can take it to the provincial level, up to the national level, because people on the ground, they don't know that you can complain, and they don't trust the complaints that are inserted in that complaint box, because they don't mostly respond to those complaints. But they can use us as civil society and people living with HIV to assist them in terms of accessing treatment and in terms of supporting them. And they need to know that when you take your treatment, chances of you living longer are very high. So you need to adhere to your treatment, because we are seeing a lot of people defaulting, which is a challenge. We will lose more people while we have treatment that can assist people.
Absolutely. Thank you so much for weighing in on this discussion. Sibongile Tshabalala from Treatment Action Campaign Chairperson, speaking to us about a report revealing some of the shocking revelations when it comes to accessing treatment for chronic illnesses in the Free State. Still